Hello dears, I will tell you the duties and rights of surgeons for patients under their treatment. It is very important to know it. Duties of surgeons. 1. Professional competence. Surgeons must maintain a high level of skill and knowledge, staying updated with the latest medical advancements, to provide the best possible care. 2. Proper diagnosis. Accurately diagnosing the patient's condition is crucial. Surgeons must utilize appropriate diagnostic tools and techniques to ensure they understand the patient's medical needs. 3. Informed consent. Surgeons must fully inform patients about their diagnosis, the proposed treatment, potential risks, benefits, and alternatives. Patients should have the opportunity to ask questions and provide their consent before any procedure. 4. Standard of care. Surgeons must adhere to established medical standards and guidelines when treating patients. They should perform procedures with due diligence, care, and expertise to minimize risks and complications. 5. Patient-centered care. Surgeons should consider the patient's individual preferences, values, and circumstances when planning and delivering treatment. Communication should be clear and compassionate. 6. Follow-up care. After surgery or treatment, surgeons must ensure proper follow-up care, monitoring the patient's recovery and addressing any complications or concerns promptly. 7. Emergency care. In emergencies, surgeons have a duty to provide immediate and necessary medical care to stabilize the patient, regardless of the patient's ability to pay or their personal circumstances. 8. Confidentiality. Surgeons must maintain patient confidentiality, ensuring that all medical information is kept private and shared only with authorized individuals. Rights of surgeons. 1. Professional judgment. Surgeons have the right to exercise their professional judgment in diagnosing and treating patients. They can decide the best course of action based on their expertise and the patient's condition. 2. Refusal of unreasonable requests. Surgeons can refuse to perform procedures or treatments they consider unnecessary, unethical, or harmful to the patient. 3. Protection from abuse. Surgeons have the right to work in a safe and respectful environment. They should be protected from verbal or physical abuse by patients or their families. 4. Fair compensation. Surgeons have the right to receive fair compensation for their services, reflecting the complexity and difficulty of the procedures they perform. 5. Legal protection. Surgeons are entitled to legal protection and support in cases where they are accused of malpractice, provided they have acted within the bounds of professional and ethical standards. 6. Continuous education. Surgeons have the right to access ongoing education and training opportunities to stay current with medical advancements and maintain their professional competence. 7. Support for ethical practice. Surgeons can seek support from medical institutions and professional bodies when facing ethical dilemmas or challenging clinical situations.